In this video, we will talk about the pathophysiology of fever. Before I start, just wanted to inform that all physiology videos, MCQs, notes, question and answers for first MBBS, everything is available in the app. So just download the app and check it out. So normal body temperature ranges from 36.5 degrees Celsius to 37.5 degrees Celsius, and if we see that in degree Fahrenheit, it ranges from 97.7 degree Fahrenheit to 99.5 degree Fahrenheit. This range in temperature, basically the temperature is lesser in the morning, least at 8 a.m. in the morning and highest at 4 p.m. in the evening. Okay, and we should be aware of this diurnal variation for recording the temperature. There is some seasonal variation as well. In summers, the temperature is lesser compared to that in the winter. Now, if we see this diagram, we see the normal range of temperature, the increase and decrease in body temperature as well. So, this is the usual range of normal temperature. Going above, we see that there are certain diseases like febrile diseases, or if we do excessive work like suppose exercise, then also the temperature is going to rise. However, in these conditions, the temperature regulatory mechanisms are efficient. They are still working and they will try to adjust the body temperature according to the hypothalamic set point. So, temperature regulatory mechanisms are efficient. On the other hand, when the temperature rises too much, especially when it rises above 104 degree Fahrenheit, in that case, the temperature regulation becomes impaired. Okay, so even when the body temperature is rising, the temperature regulatory mechanisms do not work. Similar thing we see if the temperature is going down. So we see that when the temperature becomes lesser than 94 degree Fahrenheit, temperature regulatory mechanisms become impaired, and below 84 degree Fahrenheit, temperature regulatory mechanisms are lost. Okay. Now, how this body temperature is regulated? The details of this I have dealt in another video on temperature regulation. You can have a look on that. But here just we will deal with small concepts to understand fever. So we have a core temperature, that is the temperature around the organs of the body in the blood vessels. Okay, so that is core temperature, and the temperature of the skin, that is known as the shell temperature, that is the outer temperature, and that is influenced most by the external environmental temperature. Core temperature on the other hand is maintained within a normal range, that what we have seen the range. Okay, so there are thermoreceptors both on the skin. Okay, so there are thermoreceptors here and there are thermoreceptors here. Okay, near the visceral organs there are these thermoreceptors. So we have two different types of thermoreceptors, that is the surface thermoreceptors and we have the core thermoreceptors. Okay, these are present inside. The information, the temperature information from both of these thermoreceptors reaches to the hypothalamus. In the hypothalamus, we have two centers, basically one in preoptic nucleus, in the anterior hypothalamus, preoptic nucleus, and the other in the posterior hypothalamus, right? So, preoptic nucleus in the anterior hypothalamus responds basically to warm temperature and posterior one responds to cold temperature. So, all the information is going to these centers in the hypothalamus. There is integration of signals. Integration because there is shell temperature and there is core temperature. So, from outside as well as inside, the information is going to the hypothalamus, and depending on the ultimate result, there is some hypothalamic signals which initiate the responses, and these responses include the responses either to increase the body temperature or to decrease the body temperature. Okay, so suppose if the core temperature is rising, then the hypothalamic signals will tend to decrease the body temperature, and these will include causing vasodilation so that more heat loss can occur from the skin. Then there will be sweating so that evaporation of water from the skin surface can take away the heat, and there will be certain behavioral responses as well, such as switching on the fan, wearing light clothes. On the other hand, if shell temperature is lesser, indicating that the environmental temperature is less, so in that case hypothalamus will initiate the responses which will conserve the heat and also will produce more heat. So these include the vasoconstriction, shivering responses or non-shivering thermogenesis, and some behavioral responses like switching of the fan, taking a blanket, etc. So that was about the hypothalamic responses, and we will see how these hypothalamic responses are important for the generation of chills in the fever. Now, how this body temperature is measured? The body temperature can be measured either from the rectal region, which represents the core temperature. So that is 0.5 degrees Celsius more than the oral temperature, that is around 36.6 degrees Celsius, which is again more than the esophageal temperature. So rectal temperature denotes the core temperature, and most commonly measured are the oral temperature and axillary temperature. However, remember that rectal temperature is 0.4 degrees Celsius more than the oral temperature, which is little bit nearer to the shell temperature. Okay. Now, when the temperature increases beyond 37.7 degrees Celsius, or we can say in Fahrenheit 99.9 degree Fahrenheit, then it is known as fever. Okay. So, as the temperature touches 100 degree Fahrenheit, that is fever. Okay. This value is simple to remember, 100 degree Fahrenheit. When the fever is more than 41.5 degree Celsius or 106.7 degree Fahrenheit, that is known as hyperpyrexia. Okay, so remember 106 degree Fahrenheit. Okay, so that is hyperpyrexia, which generally occurs due to CNS infections. Now, how do chills occur in fever? Chills is that shivering, piloerection which occurs with fever. Okay, so for this we should know pathophysiology of fever. So remember that first thing which occurs in fever is that because of some cytokines like interleukin 1, interleukin 6, we will see in detail later, little bit later. What happens that these cytokines increase the set point. Okay, so set point is suddenly raised to a high value. Here x-axis is showing time in hours and y-axis is showing body temperature in degree Fahrenheit. So this is the normal set point. Now because of these interleukins, there is sudden increase in this set point, right? So first thing which happens is increase in the set point. Now your core temperature and body temperature are lower levels, right? So this you see, this is the level of core temperature. Suddenly the set point has increased. Now according to your hypothalamus, the body temperature is lower, isn't it? So hypothalamus will initiate the responses to increase the body temperature. Understanding, because body temperature is lower, hypothalamic set point is more. So body thinks that that is the natural set point. Body doesn't know. Okay, so according to it, this is a natural set point. So it initiates the responses to conserve heat and for more heat production. And these include vasoconstriction, piloerection, epinephrine secretion, and shivering. Okay, vasoconstriction first affects the palms and the feet. So that is why they appear cold, because blood is not coming to these regions. It has decreased. So they appear cold in fever. Okay. So initial responses which occur is vasoconstriction, and later on you see what is happening because of these responses. Now the body temperature has become similar to that of the set point. Okay, so there is matching, right? Now when this set point is decreased, say suppose there is a resolution of the infection and there is decrease in the set point. So set point suddenly reduced to low value. So in that case, now the body temperature is more than that of the set point. So now the body initiates responses to lose the heat, because the outer temperature, the body temperature is more compared to that of the set point, right? So body wants to lose that heat so that the body temperature becomes equivalent to that of the set point. So then there is initiation of the vasodilation and sweating. That's why we say that when the vasodilation and sweating is started, that now okay, the fever has resolved, isn't it? So these two phenomena are known as chills when there is shivering, vasoconstriction to increase the body temperature equivalent to that of the hypothalamic set point, and the other one is known as the crisis when the body mechanisms are initiated to decrease the body temperature, that is vasodilation and sweating, that is known as crisis. Moving on to what is hyperthermia. Before we saw hyperpyrexia. Now there is another term, hyperthermia. So how fever is different from hyperthermia? We have seen about the fever. Fever is increase in hypothalamic set point, okay, and then mechanisms are initiated to increase the body temperature. Because of that, there is vasoconstriction, so skin appears cold, and this occurs due to the presence of endogenous and exogenous pyrogens. Endogenous pyrogens we saw, these are IL-1, IL-6, okay. Other ones are also there, like TNF alpha is there, okay. So this cause increase in the hypothalamic set point, and in this condition antipyretics work. Antipyretics work, okay. We will see the mechanism shortly. But in hyperthermia, what happens? There is normal set point. Set point of the hypothalamus doesn't change, but there is failure of thermoregulatory mechanisms. Understanding? So normally also our body is generating lot of heat than is required. Okay. So always these thermoregulatory mechanisms are active so as to lose heat. Now suppose there is failure of thermoregulatory mechanisms, then what will happen? The body temperature will start rising, but still the sweating will not be initiated. So body temperature will start rising, and that is why the skin appears hot and dry. Okay, in fever initially the skin is cold, and in hypothermia we get hot and dry skin. So even though the body temperature is more, skin is dry. And this occurs because of increased exogenous heat exposure or increased endogenous heat production. One very important example is working in hot environments. Okay, if somebody is working, doing heavy physical work in hot environment, in that case, there are chances of failure of thermoregulatory mechanism. And why does that occur? That because of working in hot environment, the body temperature starts rising tremendously. Okay, first of all the person is working, so a lot of heat is being produced. Okay, working in hot and humid environment, very important. So because of this heat production, yes, there is sweating, but what happens that because the environment is humid, this sweat doesn't evaporate. No evaporation because of humid environment. So despite sweating, the body temperature keeps rising, and once it reaches the critical value of 104 to 105 degree Fahrenheit, then these thermoregulatory mechanisms fail. Okay, so initially yes, sweating occurs, but later on there is failure of thermoregulatory mechanisms. Then there are certain other causes as well, like intake of drugs which block sweating. Okay, so drugs which block sweating, if the person is on drugs which block sweating, then also this failure of thermoregulatory mechanisms can occur. Now, this hyperthermia, there is no response to antipyretics, because we will see later that this antipyretics actually prevent the change in the hypothalamic set point. Okay, we have seen in fever that hypothalamic set point is rising, and these antipyretics work by preventing that change or bringing it down, bringing it back to normal. But hyperthermia, we said that set point has not changed. In fact, there is failure of thermoregulatory mechanism. So these antipyretics don't work. So we have to do water treatment. The person is bathed in water, or wet sponging is done to bring the temperature down, and obviously the person has to be removed from that environment. Moving on to pyrogens. I told you before that there are endogenous and exogenous pyrogens which cause fever. Okay, exogenous pyrogens can be microbial products, for example lipopolysaccharides produced by gram-negative bacteria, or they can be toxins. Toxins include enterotoxin of Staph aureus, okay, enterotoxin, or group A, group B streptococcal toxins. Fine, some examples. Or they can be whole organism as well, which can act as a pyrogen. For example, in case of toxic shock syndrome caused by Staph aureus. Okay, these exogenous pyrogens ultimately result in the production of endogenous pyrogens. These are certain chemicals which are produced by the body only. Okay, so exogenous pyrogens cause the production of endogenous pyrogens. Now, the term for this endogenous pyrogens is changed. It is known as pyrogenic cytokines. Okay, so yes, these exogenous pyrogens can produce, but this pyrogenic cytokines can produce in other diseases as well. For example, in cancer, in autoimmune diseases, inflammatory diseases, and in CNS hemorrhage also they can be produced. Okay, so how do these cytokines elevate the set point? So there can be various diseases in which there will be production of these pyrogenic cytokines from WBCs, okay, monocytes, macrophages, even endothelial cells also produce this cytokine. And what are these cytokines? Interleukin 1, interleukin 6, TNF alpha, interferons, okay. So these pyrogenic cytokines are produced. Now these enter into the circulation and they act on the hypothalamic endothelium, okay, hypothalamic endothelium. Now, from the hypothalamic endothelium, prostaglandin E2 is produced. Prostaglandin. So, this is the main chemical which causes elevation of the thermoregulatory set point. This prostaglandin E2 acts on EP3 receptors. EP3 receptors which are present on the glial cells. Okay, EP3 receptors which are present on the glial cells, and these glial cells in turn produce CAMP. Okay, so there is production of this CAMP. This CAMP elevates the thermoregulatory set point. Okay, and then there are the responses which are produced, right? So what are the chemicals which need to be remembered? We have pyrogenic cytokines, then we have prostaglandin E2, very important, which acts via EP3 receptor in the glial cells which produce CAMP. CAMP activates neuronal endings from thermoregulatory center, thus elevating the thermoregulatory set point, right? Few points we should remember: that fever itself is not illness, okay. It indicates the presence of illness, but itself it is not illness. So just by taking antipyretics it won't go. We have to treat the illness, right? Sometimes the person is on antipyretics and withholding antibiotics may be required for diagnosis. Then we also look into the pattern of fever. For example, there are certain diseases with a particular pattern of fever. Say Plasmodium vivax. Okay, Plasmodium vivax infection, fever occurs every third day. On the other hand, in Plasmodium malaria infection, fever occurs every fourth day. Then there is Pell-Epstein fever. Pell-Epstein fever, which is common in lymphomas, Hodgkin's lymphomas and other lymphomas as well. In Pell-Epstein fever, fever lasts for 3 to 10 days and then again the person is afebrile for 3 to 10 days. Then there is fever which can occur every 21 days. Every 21 days. This occurs in cyclical neutropenia. Okay. So we have to look to the pattern of the fever, how it is occurring to diagnose. We have to take the history about the events preceding fever, whether the person was on drugs, whether he was working in some hot and humid environment. And we also have to take note whether the patient is an elderly, has chronic hepatic or renal failure, because in these they might be blunted febrile responses. So the person may be having some disease but febrile responses may not occur. So these few points we should remember about fever. Fever itself is not illness. We have to find out the underlying illness. Now moving on to the last aspect, that is mechanism of antipyretic drugs. Okay, so these antipyretic drugs act on various levels. You see that we have talked about the interleukins, we have talked about the prostaglandin E2. So interleukins, we have said that these are the cytokines which act on the hypothalamic endothelium and ultimately lead to the production of prostaglandin E2. So here it is shown cytokines, okay, acting on the endothelium, and there is actually activation of this phospholipase A2 by these cytokines, and this phospholipase A2 causes the release of arachidonic acid, which is a lipid which is present on the membrane, arachidonic acid. Okay, once this is released, there is action of cyclooxygenase enzyme which acts on the lipid forming prostaglandin E2. Okay, now we can block this cyclooxygenase enzyme by acetaminophen and aspirin. Okay, So we can block this enzyme so that prostaglandin E2 is not produced. Okay. So that is one. Second is we can block this phospholipase A2 action so that arachidonic itself is not released, and that occurs by glucocorticoids. So glucocorticoids also act as antipyretics. They also decrease the synthesis of the cytokines. So they decrease the mRNA synthesis of these cytokines, right? Third is anti-cytokine therapy. Anti-cytokine therapy is generally given for autoimmune diseases, the chronic inflammatory diseases in which there is increased production of these cytokines. So that will help the disease as well, and that will prevent the febrile response as well. So these cytokines are not produced, hence there is no production of prostaglandin E2, right? So that was all about the pathophysiology of fever. We also saw something known as hyperpyrexia. We saw the differences between fever and hyperthermia. And we also saw that how antipyretic drugs act. Thanks for watching the video. If you liked it, do press the like button, share the video with others, and do subscribe to the channel Physiology Open. Thank you.